Hi, you all. My name is Dennis. I'm a former high school science teacher and a recent MIT grad, and I'm the host of the Decoding Health Podcast, where we help you understand the intersection of business, health, and culture. Today, we have an incredible guest on the podcast, Dr. Simin Gharib Lee. She's a physician entrepreneur who graduated with her undergraduate degree, her medical school degree, and her MBA, all from Harvard University. She's a practicing cardiologist and is the co-founder of Systole Health, a group virtual heart healthcare platform for women. Now, she dropped gem after gem after gem this episode, so I can't wait for you all to listen. If you haven't already, make sure to subscribe to the Decoding Health Podcast so you don't miss out on any future episodes. Enjoy today's show. Dr. Lee, thank you so much for coming on the Decoding Health Podcast.
Thank you for having me.
Yes. So I'd love to hear more about the story behind your company's name. How did Systole Health come to be?
Great question to kick us off. So I am a cardiologist. I have a little bit of an unusual background. I have always been interested in this bigger picture of how healthcare works. And so had found my way to the MD MBA program at Harvard, where my eyes were opened up to different pathways to impact, like entrepreneurship. And then it was in the subsequent chapter when I was training to become a doctor, specifically a cardiologist, that I was just seeing so many challenges with access to care, really compounded by the COVID-19 pandemic, which started just as I was starting my journey as a cardiologist. And it seemed to be hitting women a little bit differently. Women tend to have a baseline tendency to delay care. 80% of women delay care to begin with. And then on top of that, all these shutdowns, worry, stress. So they were coming into cardiology clinic with just an unbelievable burden of heart disease risk factors, and some with their first heart attacks and heart failure episodes, but couldn't get in. You know, they were waiting a year to see us, a year to see their doctor, 2 years to see the obesity medicine doctor. We realized too many patients, too few doctors, and supply demand mismatch, and that something different was going to be needed. Inspired by a friend of mine who's now Systole's advisor, I realized that there's such a model as group care or shared medical appointments that allow doctors to see many patients at once, usually alongside somebody like a health coach. And so, realized that that was a great way to try to address women's heart health and all the challenges we were seeing on the ground just in our everyday experience as doctors. And, settle on the name Systole, it came to us very naturally just because that Systole is the name for the moment that all of the heart cells squeeze together in concert, in synchrony, to try to pump blood forward and nourish the heart. And it felt very analogous, women working together in unison to try to advance health. So that's the story behind the name and a little bit about the story behind the company.
I love that. I also love that you talked about the group element of what you're building as well. And we're definitely going to get to that. But,
Great.
I'd love to hear more about how you transitioned from being a cardiologist, seeing patients, to founding Systole Health. Like, what inspired you to make that transition in the first place?
Yeah, no, I think that honestly, going back to that MD MBA program, just sitting in the business school classroom like any other, MBA student, I think for me, I just realized, wow, there's so many different ways someone can attack a problem beyond just chipping away at it, at least in healthcare, through clinical medicine. And what I loved about what I learned about entrepreneurship, obviously it was hard. Doctors love hard, but we love a challenge. But I loved that it was very problem focused, really, and that it puts the person you're trying to help, which for us is usually the patient, at the center. And that a lot of what we learn in medical school is readily transferable to entrepreneurship. You have to listen. You have to really understand their needs, kind of form goals together and design solutions that meet those needs. So I liked that. And, but I still went on to do residency. I didn't go all that way to not become a doctor. I come from a big medical family. I could see how rewarding it was to just have that direct impact on patients, even if it was just one at a time. And, I'm glad I did go through training because I feel like it gives me a real sense for just what it's like to be on the ground as a patient and a doctor, and to be struggling with these things, these challenges like access, heart health. But I'm grateful for it because it gave me the opportunity to see what would it be like to attack this problem through a more conventional, approach like research. And at the end of the day, it was a lot of reflection, a lot of talking to mentors and, friends, family members. I just realized that research, though it has such an important role, especially when it comes to women's heart health, where women are so underrepresented in clinical trials, didn't feel like the best match for sort of my skills, my personality. There can be a time lag to impact. Sometimes you have to really just sort of study one population at a time. So it was impact and time to impact that had me feeling a little bit restless and ultimately led me back to thoughts of entrepreneurship. And I have to say it was thanks to this amazing program at Harvard Business School called the Blavatnik Fellowship in Life Sciences Entrepreneurship, kind of like an accelerator. 1-year opportunity right as fellowship in cardiology ended, that I was able to make this transition successfully. There was programming, there was a cohort, mentorship. And for a first-time founder who's coming from a totally different industry, it really helped me feel like I had the confidence and the skills to take a stab at it.
There's just so many things you said that I just want to be able to sit in for a second. First, like the comparison between medicine and entrepreneurship, the listening to patient and putting them first, and the problem solving aspect as well. I think one thing you also said that was super powerful is just the communal element, the mentorship and the relationships that you were able to build to help you get this far. I just think that's it. It's so powerful.
Thank you.
Of course. And I know that you've chosen to specifically focus in on heart health. And over the past a few years, we've seen a lot of attention and funding just going into many areas as it relates to women's health, whether it's reproductive health or fertility, which is really just women's health. It's also a men's health issue, but that's also a different discussion. And I think also it's fantastic that funding is going into those areas. But I'm curious just because, given that heart disease is the leading cause of death for women in the United States, why do you think women's heart health hasn't received the same spotlight in the venture world as other areas?
Great question. And I think you're right to celebrate the funding that has been, directed to women's health. What I kind of sort of affectionately call Women's Health 1.0 is very much, along the lines of what you just listed: fertility solutions, reproductive health solutions. And now maybe Women's Health 2.0 is broadening the focus to things like menopause, which is so critical and really overlaps with, in terms of the target audience, with a lot of the patients we're trying to help. But I think as to why heart health among women has not received so much attention, considering the size and scope of the problem, I think it comes down to awareness, honestly. I think that what we have seen, there's, really high quality research that's been done on this by colleagues of mine, looking at just general awareness of the leading causes of death among women. And, that has fallen in terms of the accurate understanding that heart disease is the number one cause of death. That has fallen from, a rate in the mid 60s in 2009 to a rate in the mid 40s 1 decade later. And what is replacing it in the sort of hearts and minds of women is breast cancer. Women think that is, coming for us all, is the most significant threat, when in fact it's heart disease. So awareness is moving in the wrong direction. And I think that we also know heart disease, tends to affect women later in life compared to men. We live longer on average compared to men. And the innovation community, whether it's on the venture side or the founder side, does tend to, be a younger community. So that may also play into and have to do a little bit with the awareness factor. But the risk factors for heart disease, which we really, consider to be within our purview, those are rising, very much driven by the obesity epidemic. But, that with it comes the blood pressure, the cholesterol, the diabetes and prediabetes. So, I think that you're right to call that out. We hope that we'll be part of a wave of solutions that will be drawing more attention to this problem that really does dwarf a lot of the other issues in women's health.
Yeah, I think it's just, it's super important. And we know that heart health is linked to a number of different conditions, as you mentioned. And one thing that
makes you and your company different is this concept of community as medicine. And it seems to play a role in your group virtual care model. Bringing it back to that, why do you believe patients would want to participate more in group virtual care?
Great question. So group virtual care in the medicine world, in my corner of the universe, it's known as shared medical appointments. This model of care, let's just get one thing straight. It is not new. It's going to feel very new to anyone who listens to your podcast, like seeing a doctor with other patients. What? Right? Like that's very novel, but it's been around for a long time since, probably the early 90s, possibly even as far back as the 70s. It's been very well studied and widely implemented in diabetes, but also a bunch of other chronic conditions, including heart disease. And it's been shown to be very effective. For us doctors and for a lot of our partners and our customers going forward, a big part of the appeal is the operational efficiency, that it's sort of like waving a magic wand in terms of operations, capacity, access, and freeing up space to see more patients and care for more patients while achieving better clinical outcomes, which we care a lot about as physicians. But why would a patient want to do it? That is such an essential question. We always have to keep the patient at the center, right? And so what we're hearing from our own patients, the reasons that they're joining, they range from really wanting more from their care than what they're getting. They want to be proactive about prevention, and they feel a little bit ill-equipped to do that and underserved by the annual visit for like 15, 20 minutes once a year, maybe, with a few other specialty appointments thrown in there throughout the intervening months. So it's just so little time with a professional that can really guide you to be proactive about your health. That's one issue. The other, like access to care. The other is accountability, community support. For women, a lot of these issues are really couched in feelings of shame and failing, like, whether it's weight or their blood pressure, going from prediabetes to diabetes or ending up with a heart attack. A lot of women feel a sense of responsibility that they ended up with these diagnoses on their list. And sometimes, paradoxically, it's the people who are closest to us who might be the hardest to lean on. A woman who is carrying excess weight and has like a very thin husband who's never had to worry about it can't necessarily have that really open, raw, vulnerable conversation. Your best friend might be having a totally different journey. Your daughter might be anorexic while you're, struggling with obesity. So there's lots of dynamics in the people that were closest to us that make the women who we take care of at Systole seek us out because of that sense of community with strangers, as well as like a sense of accountability and motivation that comes from just gathering and hearing, okay, what worked for this other person? I'm not alone. Someone else is walking the same journey and is experiencing the same problem. So it's a really special thing to see in action. I sure felt that way when I saw my friend, now our advisor, Dr. Jacob Mirsky, conducting a few of his group visits. And we feel really, excited to be developing this model and spreading it around.
Love that you mentioned it's not something that was new. I just learned that now from our conversation.
I just learned it recently.
So I think that's super important. And I think you also mentioned something that's, again, just very powerful, that even sometimes the people's closest to you may not even truly understand what it is that you're going through. And so having people within your group that share some sort of sentiment or experiences, that's definitely just something that's extremely critical. And in what you're building at Systole Health, I know you've already started to make some progress. In fact, you had your first group heart health session. And I heard it was quite the success. You exceeded your sign-up goal by 50%, and all your participants were paying customers. That's just super impressive. Can you talk us behind the scenes of that first session? What surprised you the most in terms of the experiences that people shared?
Okay, great question. Well, I think, one thing that's been very surprising, there have been a couple of insights jump to mind. So, right now we are offering our group virtual care direct to consumer, really in that early phase of the entrepreneurial journey, trying to validate, test, willingness to pay, test out the program, rapidly iterate and refine. So, we are finding all of our patients, or they're finding us through TikTok, all places. And, we really have paid like nothing or next to nothing for marketing, been organic. And so one thing that's been very surprising is just seeing how many patients are finding us on TikTok and the breadth there. A lot of people in my generation assume that TikTok is purely Gen Z, that it's, young Americans, when in fact our age range is from the early 30s to the early 70s. And our median patient is like a woman in her 50s, perimenopausal with several heart disease risk factors. So just seeing the diversity and of patients who are finding us through what we consider to be a very kind of new, fresh social media platform has been very, it's humbling. It would challenge all of our assumptions or hypotheses coming in. And then the other thing that is really great is just the diversity. I think that, we came in very focused on cardiovascular prevention, really optimizing cardiometabolic disease, which is at that intersection of weight and heart health. It's all the risk factors, but open-minded about things like established heart disease, women who've had heart attacks or heart failure before, as well as, kind of new frontiers in heart disease, gestational disorders of hypertension like preeclampsia and how that sets women up for heart disease down the line. And what we've seen is that, diversity, whether it's based on their medical issues, their age, where they are geographically, like whether their parental status, their occupational status, has been such a rich part of the experience, and that we can no longer assume anything about the best way to form groups or the groups who are most likely to go, get along and bond together. And so that came away from, those were two big insights in our first session, that, all these different women found us, and as different as they were, they really formed a bond quite quickly, realizing that there was at least one other person in the group who had a similar issue or goal or struggle. So, now since we first, decided to do this podcast together, we've graduated that first group, we've graduated another, and, we're working on a few others on the stove right now. And those lessons are sort of, those takeaways have been reinforced and underscored.
Y'all heard that progress? I know y'all heard that progress. Okay.
Working on it.
I know one of the concepts that you've mentioned throughout this conversation has been obesity and its link to heart health. And it seems like GLPs have become super popular this year as a discussion point, and not just for weight loss, but also potential cardiovascular benefits. There's so much noise in this space, whether it be from medical professionals or just people who are non-medical professionals and giving their opinion. So Dr. Lee, I'd love to just be able to get your take on GLPs and just understand how they might fit into the broader picture of heart health management.
Yeah,
especially for women.
Great question. I mean, you're right. These have become such a sensation, whether it's in the media, in pop culture, in medicine, truly marking a chapter of what we as, a society are going through. I think, our philosophy at Systole is the same that I employ as a cardiologist at the Brigham and Women's Hospital, as Harvard affiliated hospital, which is that GLP-1s are an incredibly groundbreaking tool in the toolkit, but it's not the only tool in the toolkit. We are very blessed in cardiology to have a plethora of highly evidence-based tools at our disposal to chip away at all the risk factors. I'll just start by saying the GLP-1s, for your listeners who haven't really heard of Ozempic, and I do meet a patient like every month who has never heard of Ozempic, and it's always very refreshing. They're usually men. They started out as type 2 diabetes medications, and during the clinical trials evaluating them for type 2 diabetes, researchers noticed that, wow, they had a big impact they seemed to be associated with weight loss, as well as reductions in heart attacks and strokes. And so subsequent waves of research gave way to studies in patients who were not diabetic but struggled with obesity, or were not diabetic but had heart disease. And in the patients who had heart disease but no diabetes, the ones who received semaglutide, which is known as Wegovy or Ozempic, had a 20% reduction in recurrent heart attacks, strokes, or cardiovascular death even, despite having really pretty good cholesterol and blood pressure and being on great medications, those other tools in the toolkit. So that gives you a window into why we consider it a tool. We are not a weight loss company. I think we're not a GLP-1 only company. And a lot of our patients come to us already paying for GLP-1 solutions, telehealth solutions, or seeing a weight doctor because they feel like their care is too focused on the GLP-1, not supportive enough, not comprehensive enough. No one's helping them with their blood pressure. No one's helping them with their cholesterol. No one's really digging into lifestyle with them. So, I think that we don't sort of leave it for the primary care doctor to deal with in their 15-minute annual. That's not really fair to them either. We will prescribe it in the right patient, but it's not the only thing we do. I will say that sort of an interesting thing that we keep, chewing on when wearing our marketing hats is that we do acknowledge that weight looms large in the mind of the consumer, particularly women due to unfair societal pressures that are placed on them. And so, what we try to balance that in our messaging and outreach on social media. And I think what a lot of folks do end up the way that they end up engaging with us is maybe like come for the weight, stay for the heart health. They might be really resonating with some of our content talking about GLP-1s and weight, but then they, as soon as we start talking to them in an onboarding call, they immediately go into their fears about their cholesterol, a family history that makes them worried they too could run into heart disease. So that's a little bit about our philosophy and viewpoint on the GLP-1s, their role. They really do have a role to play, but also where they fit in that bigger picture for heart health tools.
Yeah, that's super helpful. And I'm also just glad that you provide that psychological safety for women to be able to come into a space where they can talk about their most vulnerable health conditions and how it's affecting them. And I know one of the things that you had just mentioned was about lifestyle changes. So, when you're working with patients, how do you balance lifestyle changes with medical treatments for heart disease? Did my research for the podcast. And one of the things that I've heard you mention a lot is that it's more of a both and approach rather than either or situation. And I'd love to hear more about that.
Yeah. I mean, I think there's a lot out there in digital health that is doing, a lot of players doing really laudable work trying to, use technology to make lifestyle change happen, to do some kind of coaching, whether it's a human or whether it's AI, an app, whatever, to really move the needle on lifestyle change. And as a marathoner and someone who over time found her way to plant-based eating, like I'm very passionate personally about lifestyle behavior change. But I think what we have learned from so many of our patients coming to see us, and what I've heard from my own patients, in my work as a cardiologist, a practicing cardiologist, is particularly women have been trying on the lifestyle front, usually for a lifetime. It's very humbling, a lifetime. And so, to not use the tools that we have, evidence-based, therapies, medications that have passed through a rigorous regulatory process and peer review, feels like, withholding something, especially as a physician. I recognize that other digital health companies might not employ physicians, but I get it because physicians and even NPs and PAs are expensive and costly. But, fortunately for us in our group-based model, we can really contain that labor cost and achieve that both and, really delivering on lifestyle while also using simple blood pressure meds, statins, GLP-1s, to make a very meaningful difference very quickly for patients.
That's incredible. One of the reasons why I just love what you're doing is you're opening up access to people who normally wouldn't be able to go to a cardiologist. What recently caught my attention was cardiology deserts, and that affects about 22 million Americans, and particularly affects my home region of the South. And for clarity for those listeners, cardiology desert means that you don't have the ability to access a cardiologist in your region because there is no cardiologist. So for those underserved regions, how does Systole Health plan to reach and serve those communities that traditionally have less access to specialized cardiac care?
Great question, and such an important issue. Last I checked, there are only 8,000 cardiologists in the entire country who are not on the brink of retirement age. So just sheer numbers, think about 1 in 2 Americans having hypertension, and probably, as many Americans as who are overweight, which is 70% of the population, also probably having cholesterol that's too high. We know these issues are manageable by primary care, but sometimes, oftentimes primary care doesn't have the time or the resources or the support. I mean, it's very unfair to really make a dent in those problems. And so they can and often do end up in cardiology, but only 8,000 cardiologists to go around. We are excited about the possibility to get into those cardiology deserts. I do think that as a virtual care provider, even though there's been a lot of shift in the virtual care market landscape over the past few years, we can be accessible, no 2, 3, 5 hour car rides, no plane rides. We see that. We see patients at my hospital who make those long journeys. We can be more accessible in a population where the vast majority of patients have a smartphone. And we hope to do this, our long-term, aspiration and strategy for go-to-market is to partner with health systems. And we're talking to some that are really focused on rural regions where these cardiology deserts are. And that through, a few pilots with them where we could help them, serve their populations at risk for heart disease or who already have heart disease, we might be able to really make a meaningful impact on the access issue in those regions. But we're excited to try to take that on.
It's just incredible that you're centering the patient and really thinking about their experience, and even those that are just underserved, just making sure that they're a priority in this. So I just think that's incredible.
Thank you.
Of course. And I know you mentioned this, and I didn't want to let this go by, but wanted to give you a huge congratulations, because you talked about how you had run marathons and you ran the Boston Marathon earlier this year, and you actually even set a personal record. I am not a marathoner at all, so can't relate there, but I just think
Not yet.
Maybe one day, but we're gonna give it some time. But
we're gonna work on you.
It's such an incredible achievement. So I'm just wondering, when you think about the parallels between pushing yourself to the physical limits in a marathon and challenging the status quo in healthcare as a founder, what do you see as those similarities?
Gosh, great question. And thank you for asking it. So I think there's so many parallels between endurance sports, whether it's marathons or, Ironmans, which I've never done and probably never will. I feel the same way about those as you do about marathoning. And entrepreneurship, like startups, building something out of nothing. It's an endurance sport. It really is. You got to have vision, and during the hardest workouts around the track, questioning, why am I doing this? This is completely optional. You got to have that picture in your head of what the finish line looks like, what it feels like to cross it, what success looks like, the meaning. But you also have to have a plan, a dream without a plan is just a dream. And so, I think for me, the big role that this plays is its structure, it helps ground you. And every week, every day, you're chipping away at this bigger picture thing. You're going to encounter setbacks, injuries, things that didn't go as you planned, weather, you go on a long run, you forget your food or whatever it is. But you always got to be ready to adapt. You always got to be ready to pivot. And you always need to be ready to lean on someone else. And I know that sounds weird thinking about running as a very solitary or solo sport, but many runners talk about, and I picked up running after, a brief chapter in college sports as a rower, which really was team-based. So I never experienced it on a real track and field team or anything like that. But, a lot of runners will tell you it is a team sport. And whether those team members are your family, other running friends, people in the running community, your coach, you got to be ready to lean on people when you need help. And the same is true in entrepreneurship. you can't do it all. You gotta, 1+1 is so much greater than 2. That's sure how I feel about my co-founder, Lauren McConnell, the early team that we're building. So got vision, plan, and people. And those are the big overlaps for me. I'll be putting it all to the test again in 2 weeks. I'm doing Chicago, and after that, maybe a little bit of a break for the holiday season. But it's a good thing to do in parallel with building a business. Highly recommend.
Love that. And I love that you mentioned vision, plan, the people. And I love that you really hone in on the community. It seems like, you live your company's mission. You talked about some of the accomplishments that you've had earlier in the beginning. I know that you have a virtual heart health clinic that's running in Massachusetts, but I'm wondering, what are some of the other big goals that you have for Systole Health? Hopefully coming to Texas, home state.
Yes.
But yeah, we'd love to hear more.
Yeah, we are, I think in the year ahead, let's see, I think, well, a big goal for a good chunk of time was financial, closing an initial round of fundraising, which, we'll give you a little preview on. We did close a $2 million pre-seed round earlier in the summer. We'll be announcing that shortly in a few weeks. So, but everyone will get a little preview here. And, that really gave us the fuel and the space to think about goals that, are really core to the business and what we're trying to do here. And so I think in the year ahead, patients, like as many patients as we can help. This is a play for impact. The reason I'm in this is because I wanted to help broaden my own sphere of impact beyond the 8 patients I see at a time in clinic. So more growth and impact. And then, part of that will be geographic expansion, as you alluded to. We're broadening licensure. We're really excited to come to states like Texas when that happens. And part of it will also be with that go-to-market partnership with health systems, with practices, where we can, open up avenues to helping larger swaths of patients and making a real difference faster. And in, I think critically, this is very important, like within the existing healthcare infrastructure, within the infrastructure of trust that the patient already has with their doctors that they already have, with their health system that they already have. So many of the virtual care failures that have been, written about and discussed, 2023 to 2024, at their core have something to do with operating in isolation outside of where patients are going for their care and driving fragmentation rather than integration. I think those are some of the things. And we'll be looking at clinical outcomes. We're excited to start really zooming out and assessing, okay, not just in one cohort, but in a number of cohorts, X number of cohorts. How did we do on blood pressure? How do we do on LDL cholesterol? How did we do on predicted risk of heart disease? And starting to write some of that up. And so I think we could get nitty gritty on any of them, but it's all about patients, as many patients as possible, as excellently as possible, and as scalably as possible.
It seems like you're going to have a lot on your plate coming up. And I love that folks are getting the preview as well. If y'all heard, she's out here hustling, y'all. Now, as we just start to wrap up this podcast episode, I'd love to hear just your advice for women who might be feeling frustrated or unheard in their current heart health journey. I know I've had family members that have just expressed frustration with feeling like their symptoms are just being dismissed. So what would you say to someone who's struggling to get the care that they need, or who just feels like their symptoms just aren't being taken too seriously? And are there specific steps that you'd recommend specifically for women for advocating for better heart health care?
Great question. We are here to help any female listener who might be resonating with what you just said. But more broadly, I think that women, as you said, tend to be misdiagnosed and underdiagnosed, undertreated. And so I think, but often what we hear when we are meeting our patients for the first time is that they know it when it's happening. They know that it's happening. And so I think, what I wish I could tell every woman who's out there getting told that, her indigestion is nothing to worry about and that her palpitations don't mean anything, that a blood pressure of 145 over 82 is just fine for the rest of her life, is you don't have to settle. You don't have to just sort of sit there and take it. Ask around, if whether that's for another opinion, whether it's for a referral to a specialist, whether it's your family and friends to see if they have doctors who have helped them be more proactive, who've been more responsive, who maybe just have, the kind of personality that might gel better with your personality, because chemistry matters. And we can't ignore that. So I think don't feel like you have to accept the status quo if you have that nagging feeling inside that something's not right. Women know when something is not right, and that don't ever mess with a woman who knows that something ain't right. So we're here to help, but we also encourage women to be as proactive as possible about their own health.
Period. Yes. Yeah, definitely don't dismiss the symptoms that you may be affecting you. Dr. Lee, this has been a wonderful conversation. Thank you so much for coming on the Decoding Health podcast.
Thank you for having me. Such an honor, and I look forward to hearing it on the other side.